Today we're going to be talking about a very common procedure we do here in the pain clinic called a caudal epidural. That's C-A-U-D-A-L. And caudal refers to an anatomic location. We have the lumbar position, we have the cephalad position, meaning towards the head, and we have the caudad position, meaning towards the feet. In this instance, we'll be placing the needle from below into the epidural space. What is the epidural space? The epidural space is a virtual space. It is the space between a ligament and the outside of the spinal sac, which is shown here. Normally, the spinal sac would tether down and adhere to the sacrum down around this region. After anesthetizing the skin and structures below the skin with local anesthetic, we'll enter the epidural space from the caudad position. We confirm our position with fluoroscopic X-ray guidance, and once we do so and are happy that the needle is in the correct position, we then go ahead and put our medicines into the epidural space. We place two types of medications into the epidural space. The first medication is an anti-inflammatory steroid. This is not the type of steroid that the ball players are taking, and in fact the steroid is very similar to one made in our own bodies. The purpose of this steroid is to reduce swelling and inflammation about the nerve roots that is caused by the bony degenerative changes seen in our spinal column. The second medication is called Marcaine. Marcaine is a long-lasting local anesthetic similar to Novocaine. The purpose of the Marcaine is to push the steroid medication from the caudad position and have it spread out across the lumbar spine. The Marcaine will have an immediate effect. The temporary anesthetizing of the nerve roots may serve to break the cycle of pain. The steroid medication typically takes from 3 to 5 days to become effective. On a case-by-case basis, it is very difficult to predict how effective an epidural steroid injection will be. The chronicity of the disease, as well as the number of spinal levels involved, are factors that may affect outcomes. Other comorbidities such as obesity, sleep apnea, smoking, and diabetes may also affect your chronic back pain. While it may be difficult to predict the effectiveness of a single epidural steroid injection, one thing should be clear. In the absence of an increase in physical activity, there will be little sustainable benefit from an epidural steroid injection. The epidural steroid will help facilitate a recovery that you will make. Prior to the procedure, let the staff know if you're taking any blood thinners, such as Coumadin or Plavix, if you recently had surgery or planning to have surgery in the near future, and if you are sick. All patients are required to have a driver and a person to sign them out following the procedure. During the procedure, you will be lying face down. If you so desire, we will provide you with very light sedation through an intravenous. The procedure typically lasts less than 10 minutes, and there is very little discomfort. Following the procedure, bed rest is not required, and we ask that you follow the post-procedure instructions. There should be minimal discomfort in the days following the procedure, and as a reminder, it will take from 3 to 5 days for the steroids to become effective. We do over 1,200 caudal epidural steroid injections a year in this pain clinic. Fortunately, complications are rare. If you should have any concerns following your procedure, please feel free to contact us at any time. and thank you for listening.